we are focusing on both the data side. Obviously, our last talk was with Dr. Nick Hart, focused on issues around data integrity, how data is being used. And I think that's particularly relevant given this talk when we think about information and the role it plays in terms of how individual citizens and even administrators interact with data, interact with using that information and accessing that information through the motivated reasoning framework that Dr. Deslatte uses. So without further ado, it may look like there are some technical issues that you're having, Aaron, but hopefully you're able to join us okay. And I will turn it over to you. So thank you for being here.
Excellent. Yeah, my browser just crashed as I was trying to share my screen. So there we go. Good times. All right, so we're seeing this, right? Okay, great. Well, thank you everybody for taking a minute to talk to me or listen to my presentation. As Dr. Stokan said, my name is Aaron Deslatte. I'm an assistant professor at IU Bloomington. Primarily what I do is research local government sustainability, and I do this from a kind of organizational science perspective, but also looking at kind of decision making and all of the sort of biases that can feed into and influence both individual decision making in terms of assessing risks from challenges like climate change and social equity, but also sort of how organizations end up aggregating that risk. And so for a lot of us who study sort of climate change or sustainability in general, the pandemic was a tremendous sort of shock to our research programs and also to sort of the subjects that we are researching, because we're studying local governments and states to some extent around the country and around the world that are focused on trying to address climate change and a lot of these sort of related sustainability or resilience issues. And now we have this global sort of challenge that is putting a lot of those initiatives on hold, at least temporarily. And so it posed a lot of new questions that we would need to try to address to determine sort of how does this impact the larger kind of international and local effort to sort of confront climate change and all of the other kind of related, as I mentioned, sustainability and resilience challenges. And so there was, an immediate sort of opportunity to jump in and try to start looking at, what sort of problems this was going to pose for local governments. And so along those lines, what was sort of very clear at the beginning of the pandemic was that there was a messaging sort of conflict that was taking place, right? And that messaging conflict has broader implications for whether or not local governments, state governments, federal governments are going to be able to organize public support for other kinds of goals. So in other words, you've probably all, at least peripherally familiar with the fact that climate change has a potential, massive, planet-changing threat, has been around for a while, and governments, by and large, have not made significant progress towards addressing that. Well, a lot of the recent research that looks at why climate change, why governments aren't taking broader steps to climate change, looks at how risk is assessed and also sort of how risk is related to trust in government and trust in the messenger and how the problem is actually framed. So are you framing this as a problem that we need to deal with now? Or is this being framed as a problem that is more intergenerational and future generations will have to take care of it, et cetera? And so, so suddenly we have, a phenomenon here that is clearly an immediate, present threat to the economy, to our social structures, to our institutions, and to progress towards addressing these other goals. So a number of people started jumping in and trying to do research immediately on different elements of how to frame sort of the problem related to COVID, the problems related to COVID, and then also sort of how those might spill over into other large problems that governments will need to address. And so that is giving you just a quick overview, the 30,000 foot level view of what I do and why this is going to dovetail into and climax with a discussion about climate change at the end of the talk. So those of you who are aware that there have been a lot of really hilarious memes that have been made of Anthony Fauci. We have sort of a impeachment is failing, release the virus meme. This is sort of a spectrum of the extent to which you trust or distrust sort of the message that's coming from Anthony Fauci. And you have sort of on this side here, we have kind of a weatherman saying no one can be wrong as often as I am and still have a job. And then we have Fauci saying, want to bet? We have here in the center, Fauci being compared to a Satan worshiper. And so is Dr. Fauci a Satanist? Then we have sort of the other side of the spectrum where clearly there's more faith on the part of the meme generator in the unelected sort of scientist or unelected science official versus the president. So if Dr. Fauci is fired, make out your will, and then trust science, not morons on the far right. So this is a really interesting snapshot or encapsulation of the broader question of, in a crisis, who do you trust? And for those of you who are not like I don't know if this is really a public administration crowd or more of a political science crowd, but in public administration, one of the first things we focus on is the difference between a public administrator, a professional manager, and a elected official, and the different incentives that these individuals, that these different types have. So public administrators are usually operating, much like Dr. Fauci does most of the time when he's not in a global pandemic, behind the scenes, providing advice and counsel and expert views to the elected officials, in this case, the president, the White House, et cetera. And, that's the way that public administrators work. And it's the way that public administrators are trained in MPA programs, largely to not be super involved or out front about policy issues. Instead, focus more on implementation and providing policy guidance, doing perhaps, policy analysis, but not necessarily advocacy or anything that could be misconstrued as advocacy. And that is rooted in this century-old desire, at least in the U.S. context, to try and build trust, to try and create professionalized public administration as a field you can trust and have confidence in, and that is not going to be corrupt, because in the United States, in the 1800s into the beginning of the 1900s, beginning of the 20th century, we existed in an era of widespread government corruption that's largely referred to now as the spoils era, that ultimately led to the progressive reform era. So the battle that's been going on, off and on, but it's heated up in the last week or two between Dr. Fauci and the president as we near the end of this election season, really encapsulates this tug of war between public administrators or professional public servants that work usually behind the scenes and elected officials. And the sometimes in this instance, what happens when you start dragging public administrators into the political sphere? Because they're, in a sense, this is tarnishing or eroding the trust, at least amongst a segment of the population, in this particular individual, even though his numbers are far, far better than the president's right now. So this is sort of an organizing point to my presentation. It's that what we've seen here now after 7+ months of the pandemic is the bear with me. I'm not used to this platform, and I'm trying to move all these pictures out of the way. Can't see my slides.
We don't see any of the pictures, just so you know. But
What? Says I'm sharing. Okay. Well, this is awesome. All right.
at least I don't.
Well, I've been using Zoom for the last 7 months, and I don't know how to use this thing. I'm trying to share. All right.
We saw the pictures on the last slide.
But you don't see this.
So we see bullet point 1 and 2. We've got a long road ahead.
Okay, yeah, that's what you're supposed to be seeing.
Okay.
Okay. Now, how do I get rid of all these pictures? Oh, why can't you people use Zoom? Oh, my goodness. All right. How do I get rid of this? I really can't even see my slide.
I can read it to you.
Oh, you can? Okay. Well, there's just Google is just, I'm glad that they're being sued. All right. Okay. Well, I'm just going to blast on. I don't know how to read this slide. Sorry. So SARS has, over the last 7 months, exposed fundamental weaknesses in our governance, in our system of federalism. And it has pointed out to something that's been going on for a very long time, which is the degradation of our administrative systems and capacities. So the bullet point, the takeaway from this presentation is that public administrators here, and I mean people who work in government, need to be able to be less scared to advance a more equity-based assessment of the vulnerabilities that we have in our communities, and to develop and be more out front about risk-based communication strategies. So this is a presentation that I like to give typically to people who are city managers, who are going into government work and are anticipating being some of those behind the scenes sort of officials, but that are also usually in a position of specialization or expertise. So they tend to know what they're talking about, but oftentimes they don't. They are maybe not directly involved in trying to communicate their expert knowledge, their understanding of a particular problem to a larger public audience. All right, we see this screen. Still see me, Eric?
Yeah, so it says managers need to understand.
All right, just making sure. Last time I changed the slide, it didn't work apparently. All right, cool. So let's start off with a quick overview of partisan motivated reasoning. First thing here to understand is that all human beings, we are all motivated reasoners. And so what motivated reasoning means, and this is out of the political psychology and broader psychology, behavioral economics literatures, motivated reasoning means there are really two processes at work every time we process new information. So right now, as you were all sitting there, hopefully still paying attention to me on your machines, there's a dual process that's playing out. There is a directionally reasoned process, right? A cognitive process where you are literally just looking at information and your brain is retrieving memory objects that help you understand and process in a more rational, objective fashion what you're seeing. And then there is a affective process, an emotional process, where sometimes when I put up pictures, for example, of President Trump or President Obama, you have an immediate, automatic, emotional reaction to that as well. And that affective process happens automatically. And so that in many instances, when we are engaging or processing information that triggers an emotional response for us, that emotional response activates before the conscious cognitive process does. And it, in many cases, colors our processing of the new information. So this dual process system means that we oftentimes engage or we experience cognitive dissonance. In other words, new information that we find that threatens our prior beliefs about how the world works, we find disconforming to our prior views, and we want to challenge that. It makes us uncomfortable, it makes us anxious, and because of that, our brain tries to rectify that by discounting information that makes us anxious and highlighting or weighting information that makes us feel comfortable, that conforms to the way we think the world works. And this is the best way that we have of trying to explain why people can look at the same information and reach fundamentally different conclusions about the importance or the merits or the value of that information. It is because along many dimensions, but particularly now along partisanship, a dimension of partisanship, we engage in highly motivated reasoning. And so for those of us who study this concept, the coronavirus was from the beginning a natural experiment, if you will, on motivated reasoning, because we immediately see conspiracy theories that start erupting kind of all over the planet. They involve sort of where COVID came from, what technology's role was in sort of spreading the disease, what the scientists and public health professionals sort of trying to address the disease are really up to. Are they really trying to combat it or not? Are they lying to us? So a lot of potential seeds of distrust, were sort of sprinkled across to the media landscape, relatively quickly after the emergence of this disease, and even before we really were taking it seriously in the United States. We have, policy leaders telling us that this is not a problem and this will, not be a threat to us, and that causes that sort of that seeding of that misinformation or mistrust, because you're getting conflicting messages basically from the very beginning of COVID, and so as a result of this, it's important to understand though that everyone engages in motivated reasoning. I do it every time I unfollow somebody on Twitter that makes me mad because they've said something, really partisan that I don't agree with or whatever. I have to sometimes resist the urge to do that because I don't want to create my own sort of bubble, social media bubble. But that's because I just immediately, instantaneously want to do that because I've just felt threatened by something they've tweeted. So we're all like that. At the same time, we do want fundamentally to be able to trust in our government, in our elected leaders. This is, even though if you look at trust in government in the United States over the last 40 years or so, you'll see it's steadily declining, but we still want to. We still want to have trust and faith in leaders. COVID-19 is an event, an especially potent event for creating some of the ingredients, though, that lead to motivated reasoning and that lead to distrust in government. The phenomenon itself breeds uncertainty and anxiety. And in this instance, there's lots of research that shows that the actions of government in these situations can increase trust. And so it's interesting, if you look at the Pew Center research or survey data from the beginning of the outbreak, you see that, and it really crosses along partisan lines for the most part too, back in early March, that most people felt like, most respondents felt that the state and local governments were taking appropriate responses to the outbreak. And so this is sort of shows up in this time period, this early window where governments are clearly trying to figure out what to do. It's not totally clear. The message from the CDC is not totally clear because we're operating in an area where we are not understanding the causal connections between this, behind the spread of the disease. We don't really know. We don't really have a lot of data on it, so our information is low. Our understanding of the causal process is low. But governments are trying to respond, and by and large, they were getting credit for it. The early survey data show that people were more willing to conform to or follow the mandates, shelter-in-place orders, et cetera, but also that they viewed the response at that time to be appropriate. So what this intimates, right, is that risk communication here is important. And if you're trying to build trust as opposed to reduce trust, it's important to provide timely, relevant, and accurate information, because that just assumes that citizens, the public, can figure out, and discern whether or not you are being honest. And risk communication assumes that they will know if you're being dishonest, right? It assumes that what they need you to do is level with them. And if you level with somebody, they are more likely to place some trust in you because they don't feel like you're being deceptive. So this sort of all falls under a field of research known as risk communication. So trust in government, though, requires conveying a reality about the current state of the world and its challenges. And so what we also see immediately in the data after the beginning of COVID is the disproportionate impact, right, that the disease has had on communities of color, on higher and lower income households, where you fall in the country based on, sort of the responses of the government. So a disproportionate impact. Not everyone was impacted immediately. And if you look at trust in government, you also see disproportionate levels of trust versus distrust across many different groups, across lines of race and ethnicity, across age, across education, and across household income. And so what that means is that you are not developing, if you are trying to build trust in government, you need to recognize that there are groups that are more distrustful than others, and you need to tailor this message to those groups. And you need to understand why those groups are more distrustful. So understanding that sort of a recognitional equity question, where you need to know what is underlying why some particular groups have lower or have higher levels of mistrust than others. And oftentimes, though, this can be addressed by simply acknowledging disproportionate or disparate racial ethnic impacts of policies or of problems, disproportionate economic impacts, and acknowledging and identifying and trying to give some credence to social vulnerabilities, right? And so this is really kind of one of the key points I'll keep harping on, is that social vulnerabilities are something that need to be built into the way that government responds to a lot of these problems. So to look at this issue of trust, there were a number of people went out and began immediately running experiments. I was one of them. I wanted to look at how the COVID information performed, or how COVID policy recommendations were being framed and delivered to the public. And so if you recall, in the early days of the pandemic, there were two pretty clearly contrasting messages that were being delivered. One of which was to try and positively encourage social distancing and only going out for essential services, and don't make a trip to the store if you don't have to. And then another message, which was we need to support our economy and try to help the economy restart. And so around the end of March, this was a time when the White House coronavirus task force was still engaging in its daily briefings, and sometimes for hours. And there was just a lot of messaging going on, and a lot of this sort of contrasting sort of framing of the same problem. And so I ran an experiment in which an online experiment through a research outfit called Cloud Research, where I impanel a panel of roughly 1,350 individuals from across the country. And I administered an experiment to them where I delivered COVID information on what the latest science said about how the disease was spread, what the best recommendations from CDC were to try to avoid catching COVID, and then I delivered to them one of two different frames. And so one of the frames was to encourage social distancing by sort of going to the store as infrequently as possible and keeping your distance from others when in public. And then the second frame that another portion of the panel got was to help support the economy by spending money. And so the people in the experiment get two different frames. They get one which is a pro-public health frame and one which is a pro-economy frame. Now, they don't just get the message frame. The frame gets delivered by a specific messenger. So everyone in the panel was randomly assigned to one group with a distinct messenger. I had 4 different messengers. One of the messengers was the health officials from Johns Hopkins University, public health officials. One of the messengers was the CDC. One of the messengers was your state or local government. In this case, I have Governor Cuomo featured here, although I can't see him. I just see the picture of Erick. And then the other messenger was the president. And so these are all realistic examples or anecdotes of messengers that were in the media at the time, delivering to some extent more or less pro-public health versus pro-economic sort of messages or framing of these recommendations. So after they get the communication framing treatment, what the respondents were asked was, would you consider the source of the information on COVID-19 to be trustworthy? And then a second question asked, and these were the order of these questions was randomized. A second question, though, asked whether they considered the source to be knowledgeable. So basically what I'm trying to do in this experiment is determine whether or not, based on what message you received and what messenger delivered it, did you view the source of the information to be credible or less credible? Did you find the messenger to be trustworthy? And did you find the message to be knowledgeable, or the messenger to be knowledgeable? And so here's what I found. So basically, what is relevant to look at here, and I won't cause you to strain your eyes too much on the numbers, is very strong interaction effects across the panels. So for trust, we see the health frame when it is utilized, having a significant positive effect on trust. And in this case, the positive health frame goes across all four messengers. So in other words, all four messengers got a trust boost when they were presenting the health frame. When we look at the knowledge model, 3 of the 4 messengers also got a knowledge boost when they were using the health frame. So generally the respondents, and this is, again, they're randomly assigned to groups to control for the other factors in the model. So all of the respondents that received the health frame viewed the messenger to be more knowledgeable than the respondents who received the economic frame. So they clearly gave a knowledge and a trust sort of benefit or boost based on receiving this pro-public health framing of the problem. To break it into some numbers here a little bit, the probability of finding the CDC extremely trustworthy, because again, this was kind of a 5-point scale. 5 was extremely trustworthy, 4 was trustworthy. But the probability of finding the CDC to be extremely trustworthy moved from 0.36 to 0.59 with a health frame. So just using the health frame makes a significant boost here. Roughly 60% of the respondents found the CDC to be extremely trustworthy. Interestingly, the president also saw a similar climb. That trustworthiness went from 0.29 to 0.49 when the health framing was utilized. And what's interesting about the experiment was, at the time, this roughly synced up with the public polling that was available about how trustworthy they found the organization in general. So there were polls coming out at the time that showed roughly 65% or so of the public finding CDC at the time to be extremely trustworthy. And what the result shows here, though, is that in an experimental condition, if you change the CDC's message to an economic frame, you would see that trust decline, right? That is what you could infer from the results of the experiment here. And to some extent, that is clearly what has happened. So the results basically of the experiment indicate that clearly the framing matters. When you're framing the COVID recommendations in a pro-public health frame, people generally responded more favorably. And there was a slight edge that was given to sort of the public administrators, the CDC and the public health officials. But even the elected official, in this instance, President Trump, received a trust and a knowledge boost by using that frame. I don't want you to take one experiment as sort of the final answer of the question either, though, because I wasn't the only one running experiments like this. There were many other experiments. And a lot of additional research has come out since I ran my experiment in late March that has basically found comparable results, right? That generally, when there is a clear public health framing of what the recommendations or guidance are from government officials, that was at least early on in the pandemic viewed as the truth, viewed as being trustworthy or reliable information. When I did this is a screen grab of a Google Scholar search I did this morning. When I did this Google Scholar search for government trust COVID back in March, there was about 100 results. Today there are 1,580 results. So there's been a lot more information that has been, a lot more studies that have been conducted looking at trust in government. So there's a lot of research out there. So anyway, if you don't believe my evidence or want to take my word for it, then just go do some Google scholaring or scholar Googling, and you'll quickly find a lot of other evidence. Here's one study that I think came out today, that I found today anyway. Effects of COVID pandemic and nationwide lockdown on trust attitudes toward government. This was a study that was done in New Zealand, where they actually surveyed citizens before the lockdown and then after their lockdown to look at what the effects of the lockdown were. Interestingly, they found people in the pandemic lockdown group reported higher trust in science, politicians, and police, higher levels of patriotism, and higher rates of mental distress compared to people in the pre-lockdown pandemic group. So that mental distress thing has obviously gotten a lot more attention as well since the early days of the pandemic, and drawn a lot more attention. But this is an actual field experiment which comes to perhaps a very similar conclusion to what my survey experiment did, which is that sort of quick, sort of decisive action in this case, rather than information provision, did increase trust, though, increased trust in science, in politicians, and in police, and as well as higher levels of patriotism. Of course, this is in New Zealand. But generally, this result has been replicated in a number of other countries as well. And it speaks to the point I made a few slides ago about heightened levels of anxiety and those windows where public officials can actually engender more trust when they act decisively, and the public interprets them as acting broadly in the public's interest. And so that is sort of that window where we had to operate. So where are we now? This is another one of the memes, I think, that captures where we are now, right? This is the infamous palm slap, where what does it take for a health professional to touch his face? Our current state of affairs. There are very real world consequences for a lack of trust in government. And we're seeing that right now in the phase 3 clinical trials for COVID vaccines. We see this disproportionate impact when it comes to trying to get Black people to participate in the actual clinical trials because of this historic distrust in government and in scientific research. And so this is a study that came out this week in the New England Journal of Medicine that says, recent data show that although Black people make up 13% of the U.S. population, they account for 21% of deaths from COVID, but only 3% of enrollees in vaccine trials. And so this is a very real manifestation of the consequences of a lack of trust in government. And there are many others, but in this case, you see once again just a disproportionate impact for communities that need to be focused on and where this trust gap needs to be built. And instead, I fear it's being diminished. If we look at the country broadly today, this is the more recent Pew Research Survey data. We see Americans generally view handling of COVID trailing other wealthy nations. There's a very clear partisan divide here. 62% of the survey respondents in August felt that the United States had been less effective than other wealthy countries. If you look at the Democrats in the survey, 87% felt that the U.S. had been less effective, and only 34% of Republicans. And then if you look at sort of how well public health officials are doing in handling the virus, and this is the numbers that scare me more, because these are the public service professionals, public health officials, and you see a clear decline amongst Republicans in how well they feel public officials are handling the pandemic. And that is a major drop, where you see the Republican decline from 84% back in late March or mid-March down to 53% of Republican and lean Republican today. So this is going to bite us whenever we do actually have a vaccine, and it is going to make, I would predict, the actual vaccination of the country much more difficult because of this lack of trust. And so this is a real world kind of implication. There are going to be other implications, though, as well, and other problems. That we didn't get into this place where people generally distrust government overnight. It has been building since Watergate in the 1970s and the Vietnam War. Coronavirus, here in another study, is going to undermine trust in government, scarring body and mind for decades. And this is going to, in many instances, perhaps spill over into other problems as well. So hyper-partisan nature of American political discourse and resulting distrust of scientific and administrative expertise is going to continue to play out, unfortunately. We've seen the politicization or the partisan weaponization of COVID research and sort of COVID policy recommendations today. And we see that over the last 10 years or so in climate science as well. So this is sort of the state we're in. We have this partisan divide in the country that creates or feeds into this overarching distrust of government, and that makes it very difficult for government to deal with these existential threats. And so moving forward, that's what I want to sort of focus on with the last minute or two of my presentation. COVID is only one of multiple existential threats that we as a society are going to have to face, should be facing now, and are going to have to face in the future. Pandemics produced inequality and human death and suffering, despite the efforts of local governments to aid their low-income minority and immigrant communities. Professor Stokan and I were involved last spring in working on another paper where we looked at the hundreds of different local government responses, the short-term responses to COVID, where they were suspending, evictions, where they were suspending water shutoffs, where they were taking a number of short-term policy steps to try and help lower-income, more socially vulnerable segments of their populations. Though many governments have now, they haven't been able to keep those temporary steps in place because we have not had a stimulus package that is provided funding to state and local governments. But there was a recognition initially at the part, at least of local governments, that they needed to address the response to this in a socially equitable fashion. They needed to recognize people were going to be disproportionately impacted and respond accordingly. And so this is not the only case, though, where that will happen. Climate change is already exacerbating public health inequalities across the country and the world. It does this through heat waves. If you were poor, if you live in a community of color in a large city in the United States, you were more likely to suffer from heat waves, from heat island effects. You were more likely to be in floodplains. You were more likely to suffer many of the actual consequences of climate change, the real health and sort of physical impacts of our changing climate. And this is something that requires to be taken as seriously as COVID. And, unfortunately, most of the time it has not been. But there are a number of tools that policymakers and local governments have that they can use. There are tools that CDC has had out, that the EPA have had out for years, that, for example, local governments can use to focus on planning and intervention in low-income minority neighborhoods. This is one tool. It's called CDC's Social Vulnerability Index. It allows you to look up at a local level sort of which areas in a community are higher or lower in their social vulnerability index. There's this score that is weighted based off income, based off transportation needs, based off language minority, racial minority, ethnic minority categorizations, and it identifies where you should focus, for example, on disproportionate impacts for something, like a pandemic or like climate change. And these tools are really easy to overlay with, floodplain mapping and other kinds of tools where you can recognize places that are going to be hit harder, for example, by climate change. So some of the lessons that we have hopefully tried to learn out of COVID and moving forward, we can address with some existing tools, which is what's partially frustrating to see so few cities and governments actually utilizing these tools that are available. It, in part, is just a lack of knowledge that they exist, but there's also a real lack of leadership in many governments. I'll single out a few governments that are doing things well. Cleveland has done a wonderful job in their climate resilience planning and adaptation of using racial equity tools. They developed their own racial equity tool to try to look at every policy they're adopting to try to deal with climate change and determine if it has a disproportionate impact on racial minorities in the city. And if it does, they go back and try to change the policy so that it doesn't, they ameliorate that impact. And so that is a city that actually is sort of taking these things seriously. Houston, which is the picture I just showed you, this is flooding from Hurricane Harvey in 2017. When that hurricane hit, the communities that flooded the worst were the minority communities, the low-income communities that were in low-lying areas. And so these kind of events are going to happen more frequently as we move forward into our warmer future. And so these are examples of where you can use tools like this to sort of identify places that you need to steer resources, that you need to sort of prioritize as you engage in climate adaptation and mitigation. But more importantly, and more relevant, I guess, not more importantly, but more on point for this conversation, this all begins with trying to build trust, trying to establish some degree of rapport. And this is just where we have to acknowledge as public administrators, as public service professionals, that the last 40 years have degraded our capacities. We cannot solve problems as well as we could have before. We have lost resources. We no longer attract sort of the best and brightest to work in the federal government necessarily. And so we need to reestablish trust. And this was, in my view, COVID was a golden opportunity for governments, large and small, to build trust, to demonstrate that we were not prepared. We didn't know exactly what hit us initially, but we could have responded in a way that was transparent and clear and recognizing all of the potential impacts and done a better job. Now, we don't have data necessarily on how local governments are viewed right now and their responses to COVID. That would be very interesting. We have information on how the federal government is viewed, and it is not very well. But the point here is that messaging clearly matters. Communicating risks of future pandemics, floods, sea level rise, extreme heat, air pollution, natural disasters is very important. It is important for public officials, for policymakers to frame the risks and not just give a sunny version of what we could do if we put our minds together. You need to be honest about threats and where preparedness is lagging. And in the case, if you look down the list of most of the major existential threats that our society faces, we're not ready to deal with those. We're not dealing with them very well. We have $1 trillion in infrastructure we need to build in this country, right? We're not even coming close to meeting the Paris Climate Accord requirements. Are we going to be more or less prepared right now for the next pandemic? Because there will be another one. It's not clear to me at all that we're going to be more prepared for the next pandemic. We haven't figured out how to handle this one yet, right? So in many respects, we're not prepared. And guess what? That can actually be something you use to your advantage. If, in this case, I think the horse has left the barn, as we people in the country like to say, who still have barns somewhere. In this case, trust has been blown. But that doesn't mean that you can't continue to kind of build trust in the future. But what's critical to do that is being honest. It is leveling with people and respecting them and trusting that they are going to understand that you are presenting an accurate information, an accurate picture of the information as best as you can with the information that's available now, and that you have their interests, their best interests at heart. That's where the entire debate between President Trump and Fauci and all of the things that get thrown at Fauci now and at the CDC as well is disheartening because, for the most part, there are examples you can point to where clearly, political pressure was applied to, the FDA or to CDC and they caved. And then you can point to examples that are coming out in the media just about every day where they fought back. They resisted political pressure to do something that was not scientific or was not the best advice. And unfortunately, what the public generally does is look at these things and just discount it all at this point. We're not going to trust anything that we see, and that is a bad state to be in. Last slide here. I want to show you some things I tweeted out today, and then I'll shut up though on this point. If I were to go out right now and try to, for an audience, frame, okay, why do we need to take climate change, that seriously? Why is this as important a threat as COVID or even more so? I would say, well, there are clear connections between them. They're interrelated to each other, and you can tackle one while tackling the other. But I would pull some information that just came out today. So these are three articles that came out. The first is the UN report on the uninhabitable hell that the planet is going to look like on the current trajectory that we are on, where climate change and disease are going to become a lot more prevalent. Their impacts are going to be a lot more devastating around the world. And this is just one of a constant stream of reports like this that just show the dire consequences. This is a particular kind of framing, though. This is if you look at risk aversion or loss aversion, this is a loss framing where you are showing people that this is what we stand to lose. And people actually tend to be more willing to take action when you present something in a loss frame. Second piece of information I would present to them is that the public generally gets this, right? The world, by and large, is worried about coronavirus. It's equally worried about climate change. Right now, I mean, this is a big shift in these numbers. These numbers have been shifting over the years, but right now, in the latest international survey research, we see that the concern about coronavirus and the concern about climate change amongst the general population is roughly equal. So people take climate change as seriously as they take pandemic threats. And that's an encouraging sign. That means there is potential capacity out there, support that you can build for addressing these existential challenges. And then the third piece of information is what governments have actually committed to in terms of financing to COVID sort of redevelopment and recovery. There's a study that came out today that just 1/10 of that COVID stimulus spending would be enough to, if we redirected it to climate change, to meet the Paris Accord goal of 1.5 degrees Celsius increase. So the amount of money we are now throwing into a coronavirus response or stimulus spending, if you just rechanneled some of that into green projects, the right kind of green projects, you would be able to tackle both of these issues at once. So it is, on the one hand, very scary, on the one hand, very doable, and with a lot of potential political support out there to be sort of built for this kind of response. So this is a framing, right? What I just did was frame this, and it has something that we can do, right? And that's really all that it takes. I mean, that's an extremely simplistic version of framing, but when you frame something like this, it's more easy to mobilize support, and it's more easy to sort of, you start the process anyway of building trust. So that's what that is all I have to say. I have no idea if I went 20 minutes past my time or way under my time, but I'll go ahead and shut up. Thank you all very much.
You were right on time.
Awesome.
I would have said that if it was 20 minutes less or 20 minutes over, but you're right on time. So thank you very much. This was a really interesting presentation. I'll open it up to questions, but I usually start the questions off, and one of them about your particular research and thinking about the context of framing. So you had this, which makes complete sense, is public health versus economics frame, right? And obviously interacting it with the different actors that were actually putting forth those frames. My question to you was, we know from political psychology literature that sometimes, negative advertising, for example, has a different effect than, say, something that would be in a positive frame, right? In your case, in the examples you have, was it always sort of like an affirmative frame? So if it's on the public health side, was it the president basically saying we have to take the public health side seriously, or we have to take the economy seriously? Or did you include anything where it was like a negative frame? So like when I look at public health, is that affirmative and positive? We need to care about this. or did you kind of contrast those two?
No, they both of the frames, the health and the economic frames, were both gains frames, which you'd call gains. So, and in this case, this was if I had done the experiment differently, I might have designed it with losses and gains frames for both of those, because the exigent or extant research on loss aversion really suggests that gains frames are less effective at getting people to take risks. So if you want them to engage in an activity or not engage in an activity, something that would involve some degree of risk, if you present your argument in a gains frame, they're more likely to be risk averse than if you present it in a loss frame. In this case, they're more likely to take a risk, and that's just because we just at a subconscious level are more afraid of losing something than we are of gaining something. And so, if anything, if I had done the experiment that way, it would have been a lot more expensive to run. But I think the effect, the literature says the effect would have been larger if it had been a loss frame. So I actually erred on the side of being more conservative there by using gains frames.
That's great. It's very interesting. And I have some other potential questions, but I want to open it up and see if others have questions for Dr. Deslatte, either in terms of this research or any of the aspects that he mentioned during the course of the presentation.
Hello, thank you for joining us today. So my question is that, do you think that the framing of COVID, right now would be different if it wasn't an election year?
Oh boy. Yeah, I think that a lot of the dynamics would be different if we were not in an election year right now. And I think, there is plenty of, plenty of evidence from the president's own words that, there was a real fear of leveling with people and being honest, because he, quote, didn't want to instill a panic, and that is an election year concern. And so I think in an election year, typically in an election year, everything gets framed differently. You are wanting to, if you are an elected official, you are wanting to focus on, framing successes and minimizing things that have not gone off as well as you'd like. And I think in this instance, this is sort of accelerated, right? Or there's just additional fuel on this phenomenon, because this is something that is just a bigger single issue in an election than I've ever seen in my lifetime. So everyone is focused on this issue, so much so that you have fatigue factors now in terms of part of the discounting of public health officials now is being attributed to almost to COVID fatigue, and so if this were not an election year, I think that you would still have a competing an issue framing competition to some extent, because you would still have some people. I mean, this was a debate inside public health community as well. Like, how long can people shelter in place? How long can you keep the economy shut down before you start having a lot of other negative public health, consequences from that? Increases in domestic violence, increases in crime, mental health issues that begin to explode. Lots of other public health concerns. So I think you would still see, if this had not been an election year, contrasting ways to frame this problem, because this problem is multidimensional, right? It's not a simple problem. And when you frame something, what you're doing is you're highlighting one consideration and you're de-weighting or minimalizing other considerations. You're trying to get someone to focus on one aspect of this problem, because we're all boundedly rational, people with limited cognitive abilities. We can't spend all of our time studying this people that spend all of their time studying this still don't know everything about, the phenomenon. So I think even if it were not an election year, you'd see framing. I think you'd still see an economic versus sort of public health framing that would have emerged, because at some point you'd still have people clamoring that we have to reopen, that businesses are not going to be able to survive, that it is bad for other elements of public health. But I don't think you would see it to the extent that you see in this truly abnormal election environment. I hope that answers the question. I think that's a great question, though. I hadn't thought about that.
Yeah, great question, Joshua. Any other questions?
I have a question, Eric, if that's all right for me to jump into your class.
Of course. Welcome.
Thank you. Thank you. Yeah, great presentation. Reading your article, one of the things that caught my attention was your discussion of messaging. And as a developmental psychologist, it's not the only hat I wear, but it's a primary, it is one of them that's top. For example, with COVID, we have railed against young people congregating in bars and congregating in social settings. This includes in dormitories, in bars, and in public spaces. And the message we've sent to them has been, stop it, don't do that, and what you're doing is dangerous, which actually sounds like a lot of things I said to my children when they were teenagers. And it really was not a very effective way to communicate with them, which I learned at my peril. But, from a developmental standpoint, because I think ultimately your goal here is to motivate not only practitioners in public administration, but to motivate those who interact with them, which would be the public and also other actors such as decision makers. So if we were to look at young people in COVID and their behaviors, which have put them at high risk, and then that risk has been passed to others in the population, we might look at, for example, the fact that age of first marriage has been pushed up into the late 20s from the early 20s in one generation. We look at dating issues. We look at safe sex issues. We look at they have no home to shelter in, as older persons might consider home. At worst, now half of them were sheltering with their parents, which is really not their home. But so I think but we message to them incorrectly. And I think if we look at, for example, in contrast demographics, so we have poverty and race associated with flood risk. Again, we can describe that, but after the description comes the question of what are motivating messages to these subgroups of actors and members of the public. And I think we really have fallen short in that with COVID. And I think it's a terrific area to, kind of weave into the sort of inquiry that you're doing.
Absolutely. Yeah. Excellent. Thank you. Yeah, that's one of the areas where I'm trying to run experiments now is in different framing of doing what you're talking about, is how to frame individual, in this case, support for particular policies. Yeah. So, in my limited, experience in this area, framing the potential impacts on as much as you can localize or humanize impacts, it tends to help individuals. And I don't know if this holds equally true across the age spectrum, for example, but individuals tend to understand and be more willing and be more motivated when they see real human impacts, and it is something that is closer to home, so to speak. So I agree. I think the issue. The framing of what the consequences are when they are typically stay out of the bars or you'll get a ticket, that's not a very effective way to motivate.
Thank you.
Great, thank you. And just to be clear, for me personally, I don't like to rely on anecdotes. I like numbers. That's how I make decisions. But in that case, right? So I did see another question.
And models never lie, right? Yeah,
that's right. At least not ours. All right, so I did see a question come in from Scott. Asks, and I think this is a great question, in the hyper-partisan environment, how do we restore trust in institutions when there seems to be incentives for both parties to degrade that trust for partisan gains?
That's absolutely true, and that's a wonderful question, and that's the tough answer to this. There isn't a great answer. The answer that I have to try to give, and I've given this presentation a couple other times to city managers and to bureaucrats, basically, they want an answer, like a clear strategy that's going to work immediately. And so that's why I emphasized, we didn't get into this, this period of mistrust, overnight. We have to sort of build our way out of it. So the advice that I give them, and it's tough when you're a researcher, you're a social scientist, to try to give, policy or practical advice all the time. Everyone wants a practical application of your study, and your study might just be one of 100 that's trying to build cumulative knowledge, so you can make these generalized statements. But in this case, I think it's pretty clear from the evidence that you start leveling with people. You show them, you recognize, what their situation is, that you understand their unique, social vulnerability, and you start to build trust that way. It requires, cities, government officials to just start being honest about risk assessment, which is why I think, risk communication is so critical, because you are, we're in a situation in my research, I go out and interview city managers who are trying to make gains on climate change, and they're afraid to talk in public about climate change. They're literally afraid to say the word at a public meeting because their citizens, they claim, don't believe in climate change. Well, we see to some extent, kind of the same thing, a similar phenomenon happening around COVID, where you have public health officials, at the local level, that are afraid to tell people to wear masks because they're afraid of the backlash. And at some point, though, you are the expert, you are the professional, and you have to tell people the truth, and the truth can still be a tonic, right? So I think where I would start is that you just have to be more honest. You have to be more forthright and frank about the threats that we face, and that gets back to the loss aversion sort of phenomenon. Like, we need to properly explain to people, to the public, what the future is going to look like. It does not look pretty, right? And covering that up or sugarcoating it, or saying like, oh, we're great because we've adopted some sustainability plan and yada yada. I mean, that's not going to cut it. You've got to be really honest with people about what we're in for, and that is a motivational tool that I think would help to start building that trust back. But it's clearly, trust is clearly something that is degraded, as the questioner asked, for partisan gain extensively, and that is a problem that our political system, has to confront. From an administrative position, though, and that's why I called that one section in the paper, don't bother speaking trust to power anymore because they know the truth already. That's a Noam Chomsky quote. Speak truth to the public, like speak truth to citizens. And level with people. And in many instances, city managers don't like to hear that because that's a recipe for them getting fired. It's something that erodes job security. But to me, that's the only way that we kind of turn around this larger phenomenon of lack of trust in government. We have to build back capacity so that we can actually resolve problems. But building back capacity requires citizen engagement. It requires buy-in. It requires financial capacity. It requires investments. And those things all require trust. So trust is really the bedrock for us to sort of to try to be more prepared for these kind of threats.
Great. Well, thank you very much, Dr. Deslatte. Out of respect for your time, I'm realizing we've gone a little bit over. The class goes till 3:45, but it was only anticipated an hour. So thank you for taking the time today. We definitely appreciate you being here. There was one question about whether you're willing to share the slide deck.
Sure.
Okay, great. Well, thank you.
I'll send it to you.
I will get that to you, Lori. All right. Well, thank you very much. And I hope you have a great rest of the day. Be safe out there. The public health frame is a serious thing and you should take it seriously.
Yes. All right. Thank you very much, sir.
Thank you.
Sorry for the technical problems too.
No problem.
All right.
It happens. All right. I'm going to stop recording. And just, I have a couple minutes before I need to go. I just wanted to see if there were any general questions or comments. All right. Well, so we will have another speaker on Monday. It's Jeff Finkel, who is the president of the International Economic Development Council. He's going to focus pretty squarely on helping us understand what the economic response has been, and particularly among some of these public administrators whose primary responsibility is to actually foster local economic growth. He actually runs the training for certifying economic developers across the country. So it should be a pretty interesting discussion and seeing, what his organization does to support these economic developers, but also to hear, how they have responded. So that will be the talk on Monday at noon. And use the regular link that's set up for the weekly Monday discussions, not this particular link. So unless there's any further questions, thank you guys for joining and for the good questions for Dr. Deslatte. Thank you.
Great. Thanks, Eric. Really appreciate it.
Oh, thank you. Take care.
Bye.
Bye. All right. Thanks, Elsa. You as well. And take care, Amy.